Good morning, VETAHEADers. Good morning. Dr. Proença here for one more darlings. It's that time of the month where we talk about favorites, favorite equipments or services that let me put my glasses, that I have been using, that I like. Hello, guys. Hello, Vidicus group. Hello, Camila. How you guys doing? Dr. Proença here, or VETAHEAD Mama, as someone named it yesterday, and I loved it. Again here today to talk about VETAHEAD Darlings. So the VETAHEAD Darlings, if you don't know, is where I share equipment, services that are related to veterinary medicine, or more specifically to zoo med or exotic animal medicine, things that I have been loving to use and I want to share with you because they make my life easier. And today I'm going to be sharing one equipment that I use a lot for birds, sometimes for reptiles as well. And it's a simple thing, however, it does make a difference. So I'm going to be sharing this with you. And full disclosure, none of this is sponsored, okay? These are actually things I purchased myself, that I use it, that I like it. It's part of my routine. And I want to share it with you, okay? Also, now we have all these darlings. They stay recorded. So you can visit our YouTube channel and then you can see all of these are recorded. The first ones were not recorded, but they are here on Instagram. Well, sorry, they were recorded, but they were not on our YouTube channel. Now they are, but they also live here on Instagram. If you look at the videos, you're gonna find the previous darlings, and I really recommend you take a look on the previous ones because I share really good stuff. Was anyone here on the previous darlings where I shared about scribe notes? Everybody that I've been recommending that has been raving about it, really, seriously. So I also, this plastic noise that I'm trying to get what I want to share with you here out of the plastic bag. Also, guys, I would love to know what is your favorite. What is something you have been using, something you can't live without, that makes your life as a clinician or a technician really easy? I do want to know. Okay? Awesome. Tell me here, guys, where are you talking from? Where are you talking from? You know, yesterday was my birthday and I am now 43 and I love it. My son asked, how do you feel? Do you feel 43? I really don't know what feeling 42 would mean, but I love it. I love the best age ever. I think every year I feel like it's the best age ever. And 43 is not different. So I do love it. Okay. So without further ado, I want to share with you. It's something simple that I want to share this month. But you know what? It's simple, but it makes a difference. And perhaps you are a beginner that doesn't know these things exist and doesn't know how important they are, or perhaps you have some experience but you have been using something else, or also you have difficulty finding where to buy this, which it was a little bit of an issue I had for a little bit of time. I didn't know exactly where to buy them. I couldn't find them easy to buy here in the United States. And now I found a really easy resource and I want to share with you. Is also very cheap. So I want to talk to you about this Gavage, like stainless steel Gavage tubes. They are curved. They come in a pack. I will talk about this, but I'm just gonna have one in my hand right now, which is the one I use the most, which is this one. Okay, so those are, yes, coming on point, stainless steel curved Gavage tubes. Guys, round of applause to Camila Pessoa is our social media manager. She makes all this magic happen. She is so creative, such a talented professional. I really could not be doing this alone. I could not, like literally, physically, mentally, everything. And she keeps me going. So these stainless steel, they are curved, right? So those are Gavage tubes that I mainly use for birds. However, as I said in the beginning, sometimes I will use for reptiles, especially turtles and tortoises. If I need to assist feed them or Gavage feed them. Sometimes we say Gavage feeding, but it could be medication that we're giving. A lot of times is medication. So why is this a favorite? So for parrots and many other birds that have sharp beaks, when we need to crop feed them or give them medication, and you want to be certain that the medication went in the animal, like they're not spilling, you know, there's no chance that the bird saves it in the lower beak and then spills it out. You really, or if something is a large volume, say you're Gavage feeding contrast for take x-rays, contrasted series of the GI, all of that, this is really your best friend. Why? It's a stainless steel. So when the bird bites it, and they will, it will not tear it apart. Because if you use something soft like a red rubber tube, you're gonna end up with a foreign body, right? Because they will bite it, break it, and then swallow that piece where they broke it. So you definitely want stainless steel. The other thing you really want to have is that, see, the tip here is blunt, right? And guys, feel free to ask questions, okay? So you see how the tip here is blunt? And then you can see the little opening, okay? So you want it blunt and you want it bulky. Why? Because the fact that it's bulky, so that's one, the bulkiness, like that is very big, right? So that assures us that we're not gonna put this in the trachea, right? Even though in birds and reptiles, the trachea is very rostral, so it's very easy to see. And when they scream, like it's like a big pipe opening, so you can really see where you put in the tube. This also gives us another layer of assurance that we're not gonna put this in the trachea, because this is usually bigger than the opening of the trachea. The fact that it's blunt guarantees that I am not gonna lacerate the esophagus or the mouth, the back of the throat, or even the crop, okay? So that's very good. I've seen some of these, they are straight. They are not curved like this one. Okay, see that is a curve? I do not like the straight ones very much. I prefer the curved ones, because when we are going to crop feed a bird, for example, it's really a curve that we make, right? It's a curve. So I like this, and I also like this curve here, because when I'm crop feeding a parrot, for example, I push this against, so I introduced it in the mouth towards the esophagus in the crop, and I push this towards me or towards the skin, and I can see this little bulky thing here. I can see it through the skin. Obviously I don't see it, but I can see that it's poking, right? So that already tells me, okay, I'm in the esophagus. There are many other steps that we need to take to make sure we're in the esophagus, not in the trachea, but I'm just sharing some of the things with you. Oh, by the way, guys, on our Essential membership, in the emergency course, we have videos, illustrations, step-by-step pictures, and I explain in details how to crop feed, the equipment to use. I explain in details the food to use, how to warm it up, how not to warm it up, the amount you need to have, how to calculate the calorie intake per day, all of this, okay? All of these details. Today here is just to share with you my favorite, which is this equipment. Okay, another thing you want to do, I like, and majority of the tubes will have this, is that this part here attaches to the syringe. One tip I'll give you, use lure lock syringe. So lure lock is the syringe that you can screw in here. Why? Because if it's not lure lock, once you press it, let's say you're giving food. Let's say we make a critical care and it's a little bit on the more not as liquid consistency, right? So there's a little bit of pressure, because everything depends on what we're trying to do, right? So the amount of calories we're trying to put in the animal, all of that is going to dictate how we reconstitute those critical care formulas. So let's say it's a little bit on the thicker side, and if you don't have a lure lock, what's going to happen, I'm not saying that I've done this multiple times, is that it's going to explode in your face, okay? As you're trying to push it, if it's not a lure lock, if it's a catheter tip, it will like detach from here and explode, and all of that food is gonna come in your face. Yep, it will happen. So again, that's why you want this, and I use with a lure lock syringe. Now, this comes with this particular one, which I will share with you. I bought on Amazon. It was $16, $15.99, and it comes in a package with 6 of them, okay? All 6 of them here. Comes from teeny tiny ones. Let me show you the teeny tiny ones. Whee! Okay, teeny tiny ones to this very large one. So smallest smallest to longest. Okay, this one, for example, if we're doing a macaw, for example, okay, this one if we're doing a budgie, you know, something smaller. This one great for a cockatiel. Those are the intermediate sizes. This one probably a parrot, like an Amazon. Again, another one here, perhaps depending, like a conure or something, and another tiny one here. Okay, so six different sizes. Okay, they all come for this $15.99 US on Amazon. And Cami is gonna share the link here with you. Again, guys, I don't make any money with this. I don't know the company. I don't have any relationship with the company. I just found it. It's very useful and I wanna share with you. Okay. So as you can see, all of them have the same thing. They are all curved, blunt. And why is it important to be stainless steel? The material is stainless steel. Why is it important? Because it's a surgical material that you can sterilize. Okay, you can put this in the autoclave, and you should, right? After Cami already posted here the link on Amazon for you guys. So after every use in the patient, you definitely want to sterilize this because you don't want to be introducing, you know, microorganisms from one animal to another. And these ones are stainless steel, so we allow you to use them multiple times and sterilize them, and they're not gonna rust. They're not gonna become rusted, right? You definitely want stainless steel. Okay. Also, another tip that I also share in our courses, once you're done using this, say I just crop fed a parrot, right? I just used it on a parrot. I just crop fed it. You always want to flush with water to make sure that no residues here, because if it dries inside of the tube, you might lose the tube, because sometimes it gets really in there and you can't really clean. Okay, so I always, after I use, I always flush with tap water. I also usually flush with alcohol, and then I rinse with a lot of water. Please do rinse anything product, chemical product you use in here. You really need to rinse it so well, because if you leave any chemical product inside of this, once you go crop feed or give medication to the next animal, you introducing that chemical there. Okay, then I let it dry. Then if I'm gonna use on the same patient, that's what I do, right? But also I would use them multiple times during the day, and then once I'm done using that patient, then I would autoclave. Okay, so always do that. This package also comes with this syringe, which I don't use it. Okay, this is more like, I guess, for owners. I mean, it's plastic, it's acrylic, so I don't, again, as veterinarians, we shouldn't be using this. We should be using disposable syringes, right? But just to say, this comes, and also it comes with this 2 little spoons, which I also don't use. Okay, this is like for owners to like assist feed babies. I do not use it. As veterinarians, again, we shouldn't be using this, but it's also here, I'm imagining, for owners, so that's why. But those are really good equipment. Again, the crop feeding tubes themselves, I really like it. You can sometimes use them if I'm doing, say, a snake, I rather use like a rat rubber, so something, a tube that it's a little softer, and I usually use a mouth gag. Again, it really depends what I'm trying to do, but if I'm doing a tortoise or a turtle, I might use one of those. Again, but as if you know me at all, you know I place feeding tubes on all my chelonians if I need to do medication, even short term. Now, of course, if I'm doing one, I'm not gonna place a feeding tube for that. But so if I'm doing one, I might use, you know, one of these. And but if I'm doing like a week worth of treatment, even like sometimes month, like right now, I just advised a veterinarian that is treating osteomyelitis in a tortoise, and it's gonna be a 2-3 month treatment, right? Feeding tube all day long. But when but I'm doing short term, I will use those. I really like it. And this is so cheap, guys, that you should definitely, if you have in a practice and you see a lot of birds and you constantly, like, you know, crop feeding, and it might be that you need the same size, you know, you might have 3 birds that hospitalized that all need to use this size. So it's so cheap that it's worth buying 2 or 3 sets, you know. So that's why I also wanted to share with you this resource, because it's very cheap, it's very easy to get. I know some countries like Paraguay, you guys don't have Amazon delivering to you. I'm really sorry about that, but at least if you are in the US or Brazil or Europe, I know for a fact that you can have those. Okay. Do you guys have any questions about crop feeding Gavage tubes? Let me know if you guys have any. Oh, I'm seeing some people here that are or were a part of our VETAHEAD community already. So nice to see you guys here. Oh my God, so nice. You know, this week we are going to have in our VETAHEAD community, we're gonna have a case discussion with me. So this cycle, you know, I am such a softie. So this cycle, our VETAHEAD community members asked to have 3 case discussions. So I attended to them. So usually we do 1, but this cycle we're gonna do 3. So that means we call brainstorming cases. So you bring your cases, your questions, and X-rays and blood work or anything that you might have about that case, or CT. Sometimes we have it. And then we go through the case and we brainstorm. Sometimes we talk about cases that, you know, unfortunately passed, but the veterinarian in question is like, I don't know what I could have done differently. It's kind of a mortality almost. And those are really special because we learn so much with them, and also bring so much comfort to the person that saw that patient, because all of us been through that feeling, right? Where we think we done, and majority of times we done everything we could, but still we don't understand why that happened. And a lot of times I'm able to give you an insight in a very non-judgmental way that helps you in the next cases. Okay, so we're gonna have them on Friday. If you're not a VETAHEAD community member yet, the community is different than the membership. The membership, you have access to all our courses, and the community, you have access to each other and to me. And if you're not, the link in the bio, there is a waiting list for the community. We open registration every 3 months. So this is your time to go and join the waiting list, and you're gonna be the first to know when we open registration. Anyway, guys, do you have any questions about these Gavage tubes? Do you? Let me know here if you have any questions, or if you have a different source that you're using for Gavage tubes. Again, like I told you, just make sure they're stainless steel, make sure they are curved, and make sure they have this blunt. I've seen some that are straight, like straight. They look like a needle. I do not recommend those, okay? Even the large ones I've seen, they are like thin like this, and they look like a needle. I do not recommend those. Like, the chance for you to actually lacerate tissue or rupture, you know, not worth it. And I know we're talking about the Gavage tube here, but I do want to give you another tip. I've given you some. I want to give you another tip about when we are crop feeding a bird, that it has to do with how we warm up the formula. Okay, so usually when we are assist feeding birds or crop feeding birds, because they're not eating, so we need to basically put the critical care formula in their crops to make sure they have nutrition. These formulas come as a powder, and we mix them with water, and we can mix in the consistency we want depending on how many calories we want to give, right? And for that too, guys, we calculate the calorie intake, just like we do for dogs and cats. We don't like just randomly like choose a volume. Okay, we calculate how many calories that patient needs based on, you know, if they had trauma, if they have a sepsis, if they being emaciated, not eating. It's all calculated. And then we calculate based on the metabolic rates as well, right? So we teach all of that in our course. Sorry guys, in our emergency course. But I do want to give you one tip that I also offer in our course, is that when you're warming up these formulas, do not, please, are you listening to me? Do not microwave them, okay? microwaving them, it's gonna yield that critical care formula to be way hotter than it needs to be. And usually it does not warm it up evenly. So anything in the middle is usually gonna be hotter than the rest. And then what's gonna happen if you give that into the crop of the animal, it's gonna cause a burn, and it can even cause a fistula. It can burn so much that it's gonna cause the tissue to become necrotic and open a fistula. And it's sad when I see these young birds, like baby birds or young birds. The last one I saw was an African gray, still not with all the feathers, and it had a hole, literally a hole in the neck, which is a hole that was created from inside out, right? The owner was microwaving the baby formula, and we gave it too hot, created a hole, and it was two babies, and both of them have the fistula, right? So then you need to anesthetize them. It's a surgical procedure to debride and close that communication, because obviously you don't want that communication. Every food that goes there is gonna come out of the hole. It's gonna cause a series of complications that we don't want, right? So do not microwave, guys. What I usually recommend is a warm water, thermometer in the water, like a container of water, warm water, thermometer in the water to make sure that water is also not too hot, and then you put the syringe with the formula inside of the water to warm it up that way. And you also make sure that you really stir it well to make sure that it's evenly warm. Okay, that's very important. I also do not recommend, and I know we're not talking, I'm talking about the tube itself, but I want to give you another tip because I can't help myself. I also do not recommend saving formula. So make always fresh, okay? So if you are crop feeding a bird multiple times a day, and say the volume you need to give is 5 mLs, I would make 5 mLs or a little bit more at a time. I would not make like 30 mLs and then keep using that throughout the day, right? I always make as much as I need in that moment, and that goes for all the animals. I know some of these formulas, especially the ones we give for rabbits, the packaging says we can keep them for a certain period of time in the fridge, but I often just make as much as I need and then I give to them, unless of course I leave a bowl with the critical care formula for the animal to eat. So then I just change it, 3 times a day to make sure, we're not, yeast is not growing there and things like that. Okay, because we don't want to cause more problems. Okay, guys, that's what I had to share with you today. It's our stainless steel. Oh, let me drink some water, guys. 1 second. It's our stainless steel crop tubes that I bought off Amazon. They cost $15.99, so $16 plus taxes and shipping if you don't have Amazon Prime. They came to my house, and one day, the next day I bought it, next day they were at my house, and they have this blunt tip, and they are also curved. Okay, I love them. I really think they was a super useful tool, very cheap, very accessible. Now, guys, let me know if what else would you like to see here as a VETAHEAD Darling recommendation. Let me know what you use that you can't live without, that you want to share with me, so I start using too. One more time, this Darlings is going to be recorded on our YouTube channel. It's also going to live here on Instagram, but in our YouTube channel, The VETAHEAD, you're going to find everything you need there. You know what? This spoon is so cute. I might use for honey. What do you think is going to, for my own use, not for the animals? It's going to be so cute. Look. Oh my God, I'm obsessed. Not for the animals, but for me. Anyway, oh, it has some roses here. So cute. Anyway, guys, I digress as usual. I'm so happy to have all of you guys. Thanks. Greeting from Mexico. Yay! Hola, ¿cómo estás? That's all my Spanish. But I can speak Portuguese too. Thank you guys so much, and I'll see you very soon. Bye-bye.